Good afternoon, everyone, and welcome to the podcast of the future of vascular health. And I'm Robert Long, the co-founder of Glycocalyx Research Institute, Glycocheck, and also the Genesis Health Sciences Company. And with me today as a guest and partner is Dr. Hans Vink. And so our object of these podcasts over the next several months will be to teach you what we've learned over the last 13 or 14 years with our research focused on the microvascular system and the glycocalyx, and take advantage of all of Hans' 35 years of experience as a researcher, as we've tried to dive into all the topics that affect our health. And so, because this is Heart Health Month this month, we thought we would focus our podcasts on the heart and our understanding of heart health and how it's related to overall vascular health. And particularly, we'll take a look at the endothelial glycocalyx, which we'll talk a little bit about, and also your microvascular system, along with your large arteries that you're familiar with. But before we get into that, we want to talk about, I wanted to introduce Hans and his background. So, Hans, what I'd like you to do is just take a few minutes. I know you're a really humble guy, don't like to talk about it, but you have a very strong pedigree as far as your education and all of the research that you've done and grants that you've gotten over the last 35 years that makes you one of the top experts in the world. That with the fact that you taught physiology at the university to medical students. So if you don't mind, just take a few minutes and tell our audience about your background and what's brought you to this point and all the things that you've learned, if you don't mind.
Well, thank you, Bob. I got interested in microcirculation and glycocalyx already a long time ago. So originally I was trained in Amsterdam, the Netherlands, as a physicist interested in imaging. And the end of my training as a physicist, I did some rotations in different institutes. And one of the institutes I spent some time was the medical center in Amsterdam. And I got to work with a group of people in a department called medical physics. So looking at medical issues with a bunch of physicists, biology people, engineers, medical people, so a big mix of different kind of backgrounds. And early on in the 1980s, I got fascinated by videos that were taking at that time. One of the earliest videos taking of the microvasculature. So looking live how blood flows through capillaries. And at that time was a big discussion ongoing why there are only very few red blood cells in the microvessels. And one possibility would have been there is this transparent gel that nobody sees that occupies a lot of volume in the microvessels, and thereby limiting the number of red blood cells. So that triggered me to start studying whether that could be true. And then the late 1980s, early 1990s, I got to work with one of the leaders in the field of microcirculation, Brian Dooling, in Charlottesville, Virginia. He helped me to work with him and develop all kinds of imaging techniques to see whether glycocalyx is really there. And then fast forward early 2000s, for the first time, we had some real images of glycocalyx. We started realizing if glycocalyx is damaged, a lot of functions, including blood pressure control, get disrupted, and vessels become very vulnerable, and all kinds of diseases might develop. And taking all that science that stimulated me to develop the Glycocheck system to start measuring microcirculation and glycocalyx in people, healthy people and patients. Started doing that in the first decade of the 2000s. In 2009, we got the Glycocheck method patented. Shortly after, I met you, Bob, working on a therapeutic to help people restore the microcirculation and glycocalyx. And then over the years, also teaching a lot to the medical students at the university, I realized there's not much known about what determines blood pressure and how high blood pressure is developed. And over the past few years, we have been looking at the role of microcirculation and glycocalyx. So I'm looking forward to share some of those data here with our audience on this podcast.
All right, well, great. Let's just jump right into it. So, our focus today is on hypertension And what we've learned over the last 13 or 14 years is we've done research together with other universities and partners.
So let me share my slides with you.
Okay.
So when we talk about hypertension, I think it's important to understand what controls our blood pressure, how is blood pressure determined in our body. So if you look at the graph on the left, here's the heart, and every beat of the heart, it pumps a certain amount of blood volume in our large arteries in the aorta. So for every stroke, blood is pumped into the vascular system, and that's called cardiac output. So cardiac output is the stroke volume, the blood volume per beat of the heart times the heart rate, the number of times the heart beats in a minute. And then together with the resistance to blood flow of the vascular system, so all the blood vessels have a resistance against blood flow. Some small blood vessels have a high resistance compared to large blood vessels. So if you combine the cardiac output times the systemic vascular resistance, that determines your blood pressure. So if your heart beats faster, blood pressure goes up because of higher cardiac output. If blood vessels are stiff and constricted, then the resistance goes up, and also that increases your arterial blood pressure.
So just a question for you then. As people develop different heart conditions, I guess that affects the ability of their heart to pump blood, which then is going to affect the volume that you're talking about. And then that's going to, I guess, affect the pressure that can be in the arteries and out to the microvessels as well.
Yeah, for instance, if people develop what's called heart failure, that's damage to your heart muscle in such a way that it cannot pump enough blood volume anymore. And then ultimately that will result in less cardiac output and lower blood pressures in the end. And then organs will be underperfused and organs will get damaged because of the low perfusion at the low cardiac output.
So you also said that I guess as we age and have different conditions, our vessels or arteries become stiffer, and that contributes to the resistance also, which I guess makes it so you get a backup. It's harder for the red blood cells to move through.
Yeah, there's different ways that aging affects blood vessels, and one of them is that the larger arteries that take the blood from the heart to the organs get stiffer, not as elastic anymore. So you can imagine if the blood pumps volume in the aorta and the aorta is elastic, then the aorta will distend and that will minimize the pressure increase. So if it's stiffer, each time the blood is pumped into the aorta, there's a much bigger increase in blood pressure. And also, if you go down to the organs, the arteries get smaller and called arterioles. It becomes very difficult for blood to flow through those small arterioles if they're really tight and stiff. That will also increase the resistance and the blood pressure and makes it more difficult to perfuse your organs.
So then, based on what you just said, as the blood goes through smaller and smaller pipes, if we want to think of the vessels as pipes and the pipe size, then if they become stiff, it's harder and harder for it to get it perfused into the capillary network.
Yeah, so there's an example here in these slides, Bob. Shows you from left to right how blood travels through your vascular system. So out of the heart, it goes into the aorta, then it goes into large arteries, branching into smaller arterioles, and at the organ level, then it starts flowing through the microcirculation in the capillaries. Then it's collected again in small venules, larger veins, and then large veins transporting the blood back to the heart. Now, in terms of the resistance and blood pressure at the different parts of your vascular system is shown on the right-hand side here. So the red bars shows you the blood pressure or blood traveling from the large aorta through the smaller arterioles to the capillaries and the veins. And a good thing to know is that the blood pressure will drop fastest in the vessels that have the highest resistance. So when the blood leaves the heart in a healthy individual, then the mean arterial pressure is close to 100 millimeters of mercury. So this on the left eye is the aorta. Then it goes into the larger arteries that take the blood fast to the different organs. So the still very large diameter tubes. You see there's minimal blood pressure drop between the aorta and the large arteries because there's hardly any resistance in those large arteries. And then before it gets to the capillaries, you see there's a big drop in blood pressure, and that drop happens in the smallest arterioles. So those are really tiny, tiny arteries with diameters of less than a millimeter. And those have very high resistance. So that's where the blood pressure drops from 100 to 20 or 30 millimeters of mercury at the entrance of the capillary. So this is actually where the resistance is located and also where the control of blood flow happens. So if these small arterioles dilate a little bit, the resistance goes down significantly and more blood flows to the organ where the arterioles are dilating. And then you see, and then you have low pressures in the capillaries, which is good because if pressures in the capillaries were too high, then blood would be leaking through the walls of the capillaries, causing a lot of edema. Um, and then back to the heart in the veins at a very low pressure. Then the blue bars show the blood volume. So in contrast to the resistance, which is located in the small arterioles, you see that all the blood volume is located mostly in the veins. So the veins are a big buffer where a lot of the blood volume is stored that's circulating through your body. Well, if we think about blood pressure, so why do we need blood pressure? So we need blood pressure to push the blood to flow through your organs. So in addition to high blood pressure, you can also ask the question, is there something as a blood pressure that's too low and not enough anymore to let blood flow through your organs in a controlled manner? To illustrate that, you might focus on the middle panel that shows the blood flow in an example organ, in this case, the kidney. And on the horizontal axis is different levels of mean arterial blood pressure. It actually shows if your blood pressure is above, let's say, 60, 65 millimeters of mercury and higher, then the blood flow in the kidney is very constant. And it actually tells us that the kidney has what we call autoregulation. It controls its own blood flow. So irrespective of fluctuations in arterial pressure, as long as the pressure is above 65 millimeters of mercury, then the kidney will control its own perfusion by controlling the resistance of its own arterioles. So that's a good thing. Except when blood flow gets too low, when blood pressure drops below this point here, you see that blood flow through the kidney drops significantly. And that happens at blood pressure below 65 millimeters of mercury. At that level, all the arterioles are fully dilated. The organ resistance is as low as it can get. And if you further low blood pressure below that point, blood flow will be reduced. There will be not enough oxygen and nutrients going to the kidney or any other organs, and the organs will be damaged. So if you're like in the ICU and you have like a hemorrhagic shock, you lost a lot of blood, and blood pressures plummet below this point. That's why they're so careful monitoring your blood pressure to not get below 65. As soon as it's below 65, within minutes, your kidney will get damaged because there's not enough oxygen supplying to your kidney. But it's higher, then the blood flow is controlled. So there's no problem with high blood pressures in terms of blood flow control. But there's other reasons to take care of your blood pressure that we'll show in a couple of slides. So if you talk about
Just
normal blood pressures,
about that, if I might, if you go back.
sure, Bob.
Um, you hear a lot about the relationship of progression of kidney disease and blood pressure. Why are they so related together?
Well, there's two ways they are related. First of all, a minimal level of blood pressure is very important to keep your kidneys healthy. So if the kidneys get underperfused and they're so busy all the time, they need oxygen and nutrients all the time. Within minutes, there will be damage to your kidney if blood pressure is too low and kidney blood flow is too low. At the same time, the kidney itself also plays an important role in controlling your blood pressure. So the kidney senses when the blood pressure is too low and the blood flow through the kidney gets too low. And in response, to a low systemic blood pressure and a low kidney blood flow, the kidney will secrete hormones that will help you to control your blood pressure. And there's all kinds of kidney diseases that also might contribute to hypertension. For instance, if you have a normal blood pressure, but there is a narrowing of the kidney artery, causing limitation of blood flow through your kidney because the feeding artery is almost occluded, then the
Hmm.
kidney will think there is low blood pressure because low kidney blood flow. It will secrete all kinds of hormones that will be flowing throughout your body to try to increase your blood pressure. So then you have a normal blood pressure, but kidney flow is low. And then because of the kidney is by mistake thinks it's a low blood pressure, will try to increase your blood pressure. So that's why kidney plays an essential role in controlling your blood pressure.
So kidneys not only are essential for removing waste and that, but they're an important regulator of your blood pressure in your body then.
That's true. So there's multiple functions, and one of them is to help you control your blood pressure.
Oh, perfect. Thanks for clarifying that.
Sure. Um, so this is a table just showing what normal levels of blood pressure are. So if you're close to 120 over 80, so you know if your blood pressure is measured, you always see two numbers, a high number and a low number. So the high number is called systolic blood pressure, and the low number is called diastolic blood pressure. So the systolic blood pressure is when the heart contracts, pushes the blood into the large arteries, and the blood pressure goes up. Then the heart starts to relax, and blood pressure goes down, and then every heartbeat you go up and down all the time. So this is the high number should be about 120 or lower, and the lower number should be about 80 or lower. And then when those start increasing, either the systolic or the diastolic, you get what we call prehypertension or hypertension when blood pressures go higher than 140 or higher than 90 diastolic. You get stage 2 hypertension if pressures get above 160 or above 100. And we call it a hypertensive crisis when your blood pressure get above 180 or above 110 diastolic. And the reason that we are worried
So a
about
question about
hypertension,
that.
sure, Bob.
So a question about that is, I think most people when they go into their doctor, when the nurse first takes their blood pressure, it might be a little bit high, and then when they sit there and get relaxed waiting for the doctor, when the doctor comes back in, then it's usually a lower number. What causes that number to go up at the first time? Is that just the body's reaction to excitement or stress or
Yeah,
what?
that's stress, just a white coat effect. So
Uh,
people get nervous when they go to the doctor's office. And I showed you in the beginning. So there's two factors controlling your blood pressure, determining your blood pressure. One of them is the cardiac output. And the cardiac output is determined by how fast your heart is beating, how strong it's beating. And so if you're nervous, then you stimulate your sympathetic nervous system, and that causes an increase in your heart rate, and that will increase your cardiac output, and that will increase your blood pressure.
so would that say that people are under constant stress? That's a contributor to higher blood pressure, probably?
Yes, that's one of the factors that might definitely cause your blood pressure to go up.
Okay.
Well, the reason that we care is that we know that higher blood pressures increase your risk of cardiovascular disease, heart attacks, and strokes significantly. This is just one example showing relative to a normal blood pressure of 115 over 75, if you normalize your cardiovascular mortality risk to 1, you see that every 20 millimeters of mercury systolic or every 10 millimeters of mercury diastolic increase, you double the risk of death from cardiovascular disease. So if you go to 135 over 85, you double the risk, fourfold or eightfold risk if you increase your blood pressures to 175 over 105.
So that really illustrates the point of why they say, I guess, untreated blood pressure is a silent killer. Because it's shocking that 130 over 85 doubles your risk. Because I would bet there's a pretty good percentage of people walking around, that's their blood pressure, and they're not even paying attention to it.
I fully agree, and you don't notice, you don't feel it.
Right.
And this is for every age range. So at every age, increasing your blood pressure will significantly increase your risk of cardiovascular mortality. It's also shown in this slide here. So on the left-hand side, it shows the relation with increases in systolic pressure and death from ischemic heart disease. On the right-hand side, diastolic pressures, but they show a similar pattern. So, and each line represents a different age category, ranging from 40 years to 80 plus years. So, with every age range, you go from a normal blood pressure to a high blood pressure, that almost causes an 8 to 10-fold increase in risk of dying from cardiovascular disease. And at the given blood pressure, if you look at the effect of age, going from 40 years of age to like 80 plus years of age, there's about a 50-fold increase in risk because of age. But again, within each age range, higher blood pressures give you significant increases of your mortality risks.
So it that explains why blood pressure when you go get your physical, when you're having they monitor your blood pressure like crazy. And so it is a really important factor in affecting your mortality.
Oh, very important. And the same also for strokes. So this is a very almost identical graph, but instead of death from cardiovascular disease, these are strokes. And again, increasing your blood pressure from 120, 180, more than causes a more than tenfold increase in the risk of a stroke. And again, this is for different age groups. So younger people have lower risks, and just by age, your risk significantly increases for getting a stroke. And then again, there's a strong increase with increase in blood pressure. But these slopes
Yes. It's
appear to be
interesting that
different, but
you
this is a uh, logarithmic scale, so there's still about a tenfold increase in risk if you go from low blood pressure to high blood pressure at a higher age.
So just a question. It's interesting that you start at 50 to 59, but you read in the news all the time, if you even go back to the other one, I think you had 40 to 48, but you
Yes.
see 49, you see younger and younger people having high levels of hypertension. What do you think is driving that? Do you have any idea?
Well, that's in line with the increase in the risk factors that even younger people are exposed to.
Uh-huh.
So even though we don't know exactly what causes hypertension, we do know it's strongly affected by risk factors like obesity and diabetes, smoking, body weight. All these affect risk factors, and more young people get exposed to higher levels of risk factors that contribute to all these changes.
So
And
one of the things you hear about a lot, I'm just curious what your thought is from the COVID pandemic that you see younger and younger people that have uh, these issues. Do you think any of that had to do with the COVID virus?
well, we do see that people that get infected by the COVID virus or any other serious infections, there's a couple of changes that happen to their vascular system. So they lose a lot of their capillaries. That might contribute to the higher mortality and the increase in blood pressure, but also their larger vessels get more stiff, but it gets stiffer, larger vessels. All the changes that you develop over time with age um, are amplified by being exposed to the COVID virus in quite a few people. So that definitely might contribute to these increased risks of these younger people.
So basically, it had the effect of aging them faster.
Yes. So it's a big hit on the health of your vascular system.
All right. Thanks.
Well, and then if we try to understand why people become hypertensive, uh, the biggest group of people develop what we call essential or primary hypertension. We basically know we don't really know what's causing it, and I'll go into a little bit more detail a little bit later. And a small percentage of people get really specific causes that contribute to their hypertension. So they can have a problem with producing too much aldosterone. Aldosterone is a hormone that increases your sodium levels in blood, and sodium pulls water into your blood vessels and increases blood pressure. There can be problems with your kidney.
Can
So
I just
the
ask you a question right there before you go on? So
Sure.
I know, 10 years ago or so, we were working closely with some researchers on hypertension, and we were interested in the effect of salt and salt intake on hypertension. Since you were just talking about, sodium levels. So what's the effect of salt intake? Because, that's been a big discussion point. Is salt good for you? Is salt bad for you? Uh, when is too much salt a bad thing?
Yeah, so we do work with people studying the role of glycocalyx in controlling the sodium levels in blood.
Right.
So we know 1 in 3 people are very sensitive for sodium. So when they have a salty meal, their sodium levels in the blood increase significantly and their blood pressure increases, while 2 out of 3 hardly show a change in sodium levels after a salty meal. And one potential explanation could be that the glycocalyx that we know forms a big compartment on the inside of your blood vessels growing on your endothelial surface, that glycocalyx might be an important buffer for sodium. So if you have a healthy glycocalyx, then instead of causing increases in blood sodium levels, the sodium will be stored inside your glycocalyx and thereby preventing the sodium from causing hypertension. That also might explain why some people are more sensitive to sodium than others based on the health and their buffer capacity of their endothelial glycocalyx.
So how would a person be able to figure out where, if they're falling which category, the one or the other two?
Well, there's 2 ways. There's tests. So test to take in a controlled amount of sodium and then see whether your blood pressure increases.
Yeah.
And of course, you can also measure how healthy your glycocalyx is. And that also is a good predictor on how sensitive you might be for your sodium intake.
So with glycocheck, that's one of the things we measure is the systemic health of the glycocalyx as measured by the
Yeah,
PBR.
so we are actually doing studies as we speak, working with these groups that study the impact of glycocalyx on sodium buffering and how a compromised glycocalyx makes you more vulnerable for sodium intake and control of your blood pressure.
So in theory, those people that have a thinner glycocalyx are at more risk for hypertension then? Would that?
Yes, for there's many reasons why thinner glycocalyx might make you more vulnerable for hypertension. So you have the sodium buffering issue. You will lose more of your capillaries when your glycocalyx is compromised, and your large vessels will become more stiff also when your glycocalyx is compromised. And those are all factors that might contribute to the essential hypertension.
Okay, thanks.
Yeah. That's also shown a nice introduction to the next slide. So if we talk about the biggest group of people with hypertension, so the essential hypertension or the primary hypertension, many times we don't know really what triggers the hypertension. Uh, we know that there's an important role for vascular stiffness. There's also an important role for what's called rarefaction. Rarefaction actually means loss of your capillaries. So we know at early stages of hypertension, people already show a significant reduction in the number of small blood vessels or capillaries. And as discussed before, stress or increased sympathetic activity when your heart rate goes up and your cardiac output goes up will also increase your blood pressure. And that's also, in some cases, the cause of their primary hypertension. So if we focus on vascular stiffness and the capillary density, I want to show you some of our
But just a
experimental and
question there
clinical
then,
data.
if I might, Hans, before you move on. So with the glycocheck, we are we do measure the vessel size from, capillaries from 4 microns up to 25 microns. And so basically we know risk factor if you lose your 4, 5, and 6, which are the true capillaries, And then if you have a high PBR score, which means you have a thin glycocalyx, that's obviously got to be a contributing factor to people that have hypertension.
Yeah, so we know that a damaged glycocalyx and a thin glycocalyx um, causes increase in vascular stiffness. So that's also some of the studies that we do. We see if we damage glycocalyx, your vascular stiffness goes up. If we restore glycocalyx with our dietary supplements, then also even in at older age, we can normalize vascular stiffness and make the blood vessels more elastic and also increase capillary density again. And by doing so, have a positive impact on controlling your blood pressure.
So, a question in your mind, just if I might, people that have hypertension, is it too late? Is it just going to become progressive, or is there anything they could do about it?
Well, it's very difficult for people that have hypertension to control their blood pressures, and mostly because they're not targeting the real cause of the hypertension. Um, but we are hopeful in the studies that we are doing and the data that we see that if you repair your glycocalyx, you restore your capillary density, you're making your larger vessels more elastic, that has a positive impact on your control of your blood pressure. So I don't think it's too late ever. You just need to know what to do to normalize the health of your vascular system.
Well, that's good news. So, I know there's a class of people, and we're in studies on them. They're classified as hypertensive resistance, which means even if they're on three meds, they can't totally regulate it even to normal ranges. Why is that?
Well, we don't know. There's traditional medication to try to treat hypertension, and some people just don't respond to those medications. So those are treatment-resistant hypertensives, um, and they often take multiple drugs, and it's still impossible for them to control the blood pressure. And that's probably because, those drugs, not knowing what causes the hypertension, they try to act on the kidney, to try to, affect the kidney, how it functions, how many hormones are secreted, or how much urine is produced to try to compensate for the increased blood pressure. But it's not really targeting the real causes of the hypertension.
Right. So that I'm thinking about that study that was done in the UK, where they measured all kinds of people, and the goal was to get their blood pressure uh, in alignment, but we also tracked the health of the glycocalyx. And what was the correlation? Do you recall in that study?
Oh, I have to dive back in my memory. But the purpose of the study, and I'm not sure I've seen the final results, is to see if you try different medications, some work better on some people than others, to see if the medication that works in one person, if that's because of its impact on glycocalyx and improving the microvasculature and vascular stiffness, and maybe you need different medications in different people to target directly the vasculature.
So we're still waiting to see the final results of that.
So when to see the final results, yes.
Okay, thanks.
Well, in the next one, will show you some experimental and some clinical data on the impact of glycocalyx repair using our dietary glycocalyx supplement. Oh, let's go back. And this shows in a mouse model of aging. I don't know. It shows the impact of aging and a dietary supplement on the number of small blood vessels. So on the left graph, it shows on the vertical axis how many small blood vessels you have. On the horizontal axis, the different sizes. So on the left are the smallest capillaries. And the gray data points are young, healthy mice. And the blue data points are old mice, and clearly shows about a 50% loss of the numbers of small capillaries with aging. Now, in this study, they also gave the old mice our glycocalyx dietary supplement, and those are the green data points in the middle panel. So those are old mice taking glycocalyx supplement and showing that you normalize the numbers of capillaries compared to the old mice that are not taking the supplement. So by taking the supplement, and this was a study that the mice were taking the supplement for 8 weeks, you have complete normalization of the numbers of capillaries and prevent the aging impact on losing your capillaries. Well, more data on this study. I want to focus on the lower left. It shows the impact of the glycocalyx supplement on your glycocalyx size dimension. So again, from gray, the young mice, to blue, the old mice, glycocalyx dimension is reduced. And then red are the younger mice taking supplement, and older mice taking the supplement in green. You see, taking the supplement prevents the mice of losing their glycocalyx thickness. Similarly, with the glycocheck device, we measure the perfused boundary region as a measure of glycocalyx damage. So with aging, glycocalyx damage increases, and then taking the supplement completely prevents the age-induced increase in glycocalyx damage. Well, there's more data on vascular function and more specifically on the ability to produce nitric oxide with your blood vessels. So on the top right, it shows that with aging, there's a significant loss of your ability to produce nitric oxide. And nitric oxide is an important drug that dilates your blood vessels and increases blood flow and keeps your blood pressure under control. So if you damage your glycocalyx, you lose your ability to produce normal levels of nitric oxide. And if you repair your glycocalyx, this is normalization of nitric oxide production.
So I have a question. I have a
Sure.
question about that for you about nitric oxide. Nitric oxide's become a big topic, especially in the last 20, 25 years, ever since the two PhDs got a Nobel Prize for discovering nitric oxide and its importance in the body. Um, so there's a lot of products out in the marketplace and ways that people claim to measure nitric oxide bioavailability. In this study, how did they actually measure the nitric oxide?
Well, there's different ways to do that, Bob, and it goes, in too much detail to try to explain, but they actually took blood samples and measured in dedicated machines their level of nitric oxide. That's one way. Another way is to look at large blood vessels in models so they can add the different drugs on top of the blood vessels to see how much they dilate and if their blood vessels still able to produce nitric oxide. But then that's also a way to look if the vessels can still produce normal levels of nitric oxide. So there's functional assays as well as biochemical assays to measure the amount of nitric oxide produced and if the nitric oxide is produced is still able to dilate the blood vessels. So restoring glycocalyx normalizes your nitric oxide levels and then allowing you to control blood flow better and prevent arteries to become stiff. Another important improvement with the glycocalyx supplement is on the vessel wall stiffness, as I mentioned before. So on the top left, they measured what's called the pulse wave velocity. That's a measure for arterial stiffness, because the pressure pulse travels faster through a stiffer blood vessel or than a more elastic blood vessel. So it shows that with aging, the beginning or at the end of the 8 weeks, there's a significant increase in arterial stiffness. In the older mice, before treating them with the supplement, because of age, also the stiffness was increased. And then after the 8 weeks of glycocalyx dietary supplement treatment, vessel wall stiffness completely normalized to the same levels as young mice. And as a result, if you look at blood pressure, this is the systolic blood pressure. It shows that with aging, there's a significant increase in blood pressure. At the beginning of the 8 weeks, blood pressure was also increased in the old mice getting the supplement, and after 8 weeks of treatment, blood pressure was significantly reduced back to normal levels, the same as for the young mice. So all this adds up. So you increase your capillary density, you prevent your blood vessels to become stiff, and as a result, your blood pressure is normalized in response to repairing your glycocalyx. Two other important um components in the vessel wall that determine your stiffness of your smaller and larger arteries is either elastin, which keeps your vessels elastic. So with aging, you see there's less elastin in the vessel wall, which is normalized back to normal levels if you repair your glycocalyx. At the same time, collagen, which makes your vessel stiffer, is increased with age, and also that's prevented by taking more glycocalyx supplement, increasing the health of your glycocalyx. So all these factors together, through controlling your glycocalyx, have a huge impact on your blood pressure and your vessel stiffness.
So in this study, then what we found is if we gave the subjects a dietary supplement with compounds they weren't getting normally in their diet, that they could reverse what had happened and go back to a younger state similar to the younger mice.
Yes, and that's similar. In the next few slides, I'll show you also some data that we did in humans. So this is one of our earlier pilot studies showing that if healthy individuals start taking the supplement and you look what happens in the next few months, especially you see the yellow curve increasing, which is your capillary density. So you can significantly increase the number of small capillaries taking the supplement. And then the red curve, you see there's a decrease in your PBR value or your level of glycocalyx damage. So you improve the health of your glycocalyx and increase the capillary density. An example of that is shown this here. This is a before and after recording with the glycocheck device in the kidney patient. So before taking the glycocalyx dietary supplement, very low capillary densities and very significant increases in blood flow and capillary density a few months after taking the glycocalyx supplement. In the clinical study that we finished last year on kidney patients, if you focus on the center panel, uh, we again prevent the loss of capillary blood volume in kidney patients taking the supplement, and kidney patients not taking the supplement have a significant loss of their capillaries and loss of capillary blood volume. And at the same time, we've reduced the level of kidney damage or glycocalyx damage in the kidney patients. So the patients taking placebo, there was an increase in the level of glycocalyx damage, and there was a significant reduction in glycocalyx damage in the kidney patients taking the supplement. Now, in another study that we tested the effect of the glycocalyx dietary supplement, it shows that not only you reduce your level of glycocalyx damage, so lower PBR values with the supplement, but also you reduce your pulse wave velocity, that measure of arterial stiffness, and that this is another measure for arterial stiffness called the AIX index, which looks at the peak of the pressure pulse, the beginning of the heartbeat. You see there's a significant reduction of that systolic blood pressure and reflecting a reduction in arterial stiffness in patients taking the glycocalyx supplement.
So in this study, what was it? Do you remember the age range in this? It was males and females.
I think it's, I have to go back. I think it's an age range, quite a wide age range of patients with psoriasis.
And so basically what this showed then was that those that got the glycocalyx supplement had a pretty good, significant increase in their glycocalyx.
Yeah, so I didn't show the density data, but also they have an increased capillary density. They reduced the level of glycocalyx damage, and as a result of that, the arterial stiffness was also significantly reduced.
So as that relates to blood pressure, then what
Well,
would
these are the changes in blood pressure in a similar group of people. This
mm,
shows the before and after effect on blood pressure in systolic as well as diastolic blood pressure. And similar as we saw in this example patient with high blood pressure, taking the supplement for a couple of weeks up to a couple of months. And then not only the blood pressure normalized from 200 over 126, but also by improving the microvasculature, there was significant improvement of the healing of the open skin wound in this individual. Well, with that, Bob, I think we discussed a lot about glycocalyx or microcirculation blood pressure.
Yes, so thank you, and hopefully our audience has a better understanding of the root causes and what causes their blood pressure to increase, and then some of the things that we can measure and correlate with high blood pressure. And then we also have examples of if you solve and let the body repair itself, it's possible to potentially normalize your blood pressure then. Is that the key takeaway?
That's what I would say. If you are able to repair your glycocalyx, increase your capillary density, make your large vessels more flexible and elastic, that will definitely help you to control your blood pressure.
All right, well, thank you. So if you'd like to find out more information about our research and studies, you can go to glycocalyx.com. We have all of the 125 or so peer-reviewed studies we've published, and they're identified by the condition or disease. So if you're interested in hypertension or other conditions, they're sorted that way for you, and you can read those papers if you have an interest. We also have additional videos and educational content available to you there as well. You also can find out how you could order the dietary supplement called Revasca, and also we have a directory of physicians' offices scattered throughout the United States that have a GlycoCheck unit if you're interested in getting your microvascular health score. So we look forward to seeing you next week. Next week, as part of Heart Health Month, we'll be talking about glycocalyx and microvascular and vascular, and get to the core cause of why does plaque and how do heart attacks develop, and talk about how the glycocalyx is implicated in the process that leads to a heart attack. So we look forward to talking to you next week, and thank you for joining us.
Thanks for listening to The Future of Vascular Health. Healthy vessels, healthy future. If you're ready to take charge of your health, it's time to check out Revasca. This powerful supplement is designed to protect your glycocalyx, the microscopic layer that keeps your blood vessels healthy and strong. Revasca can help support your heart health, improve circulation, and even reduce high blood pressure. It's also great for boosting brain function, keeping your kidneys healthy, and preventing vascular complications before they start. Think of it as a way to keep your body running smoothly so you can live longer, feel sharper, and stay active. Don't wait. Take the first step toward better health today. Visit glycocalyx.com to learn more about Revasca and how it can help you protect your future.